Imagine finally testing negative after a tough bout with COVID-19, only to find the ordeal isn't over. This is the reality for millions facing long COVID. But what exactly is this enigma that we call long COVID? Well, it's a persistent and perplexing condition that continues to affect individuals long after their initial recovery from the virus. Whether you've experienced it firsthand, know someone who has, or are simply curious to learn more, we're delving into the heart of this issue today. We'll be defining long COVID, piecing together its myriad of symptoms, and attempting to decode the underlying mechanisms that make it such a persistent puzzle. Moreover, we'll be discussing modern treatment strategies that offer a ray of hope in the face of this ongoing challenge. So buckle up as we embark on this journey to explore the complexities of long COVID, defining it, understanding its myriad symptoms, deciphering the underlying mechanisms, and discussing modern treatment strategies. Long COVID, or post-acute sequelae of SARS-CoV-2 infection (PASC), is not your typical illness. This condition is a collection of symptoms that persist for months, sometimes years, after a person has initially recovered from COVID-19. It's a lingering reminder of the virus, an echo of its impact that refuses to fade away. The puzzling part about long COVID is its indiscriminate nature. It doesn't matter whether you had a mild case of COVID-19, were hospitalized, or somewhere in between. This condition can affect anyone who's had the virus. That's right, anyone. From the young and healthy to the elderly and vulnerable, long COVID doesn't play favorites. It's been reported in every demographic in every corner of the globe, making it a universal concern. So what is it about long COVID that's so baffling? It's the fact that it doesn't follow the usual rules of recovery. Long COVID affects people regardless of the severity of their initial infection, perplexing patients and scientists alike. The hallmark symptoms of long COVID range from debilitating fatigue and shortness of breath to brain fog, muscle aches, and erratic heart rates. It's like running a marathon without ever leaving your bed, or trying to solve a crossword puzzle while trudging through thick fog. The struggle is real, and it's a daily challenge for many. Fatigue, unlike any normal tiredness, is one of the most common symptoms. It's a profound exhaustion that doesn't improve with rest, leaving individuals feeling drained and unable to carry out even simple tasks. Imagine feeling like you've just climbed Mount Everest when all you've done is brush your teeth. That's the kind of fatigue we're talking about. Next comes the notorious brain fog. This isn't just about forgetfulness or occasional confusion. It's a constant haze that clouds thinking, disrupts focus, and impairs memory. Picture being in a room full of smoke, trying to find your way. That's how confusing and frustrating brain fog can be. Breathlessness or shortness of breath is another key symptom. It's like being at high altitude, struggling for every breath. This can occur even with mild exertion, like walking across a room or sometimes even at rest. Muscle aches, or myalgia, is another hallmark of long COVID. It's not just the ordinary soreness you feel after a workout. It's a deep, throbbing pain that can affect any muscle group, making even the slightest movement a Herculean task. Then there's the erratic heart rate, known as tachycardia, where the heart races like a galloping horse, often without any apparent reason. This can be accompanied by palpitations, a sensation of your heart pounding in your chest, which can be quite unsettling. These symptoms aren't just annoying, they can be downright debilitating. They can come and go, with good days and bad days, often worsening after physical or mental exertion. This unpredictable pattern can make it hard for individuals to plan their day, manage their work, or even enjoy their favorite activities. It's a constant tightrope walk, balancing between doing too much and doing too little. These symptoms fluctuate in intensity, often exacerbated by physical or mental activities, and can severely impair daily functioning. But remember, understanding is the first step towards managing this complex condition. The more we know, the better we can navigate this challenging journey. Understanding long COVID requires diving deep into the body's response to the initial SARS-CoV-2 infection. Research suggests several potential mechanisms that might explain why this condition is so persistent and varied. Firstly, we have immune dysregulation. Here, the immune system, which was on high alert during the infection, continues to act as if the body is under attack, even after the virus has been cleared. This overactive immune response can potentially damage healthy tissues and lead to a variety of symptoms. Secondly, there's the theory of viral persistence. This suggests that some residual viral particles might remain in the body tissues long after the acute phase of the infection, triggering a chronic immune response. This continued immune activation could be responsible for the ongoing symptoms experienced by some long COVID sufferers. Another possible mechanism is vascular damage. We know that the virus can damage blood vessels, leading to the formation of microclots and a reduction in blood flow. This reduced blood flow could explain symptoms such as brain fog and fatigue that are commonly reported in long COVID patients. Lastly, there's a hypothesis that long COVID might trigger an autoimmune response. In this scenario, the body's immune system mistakenly attacks its own cells, as it would with foreign invaders such as viruses. This autoimmunity could potentially explain the wide range of symptoms and their persistence over time. These potential mechanisms aren't mutually exclusive, and it's likely a combination of factors at play, varying from person to person. And while these theories provide some insight, there's still much we don't know about long COVID. Further research is needed to fully understand the underlying mechanisms and to develop targeted treatment strategies. These potential mechanisms provide clues to the puzzling persistence and variety of long COVID symptoms. As we continue to unravel the mysteries of this condition, each discovery brings us one step closer to finding effective treatments and, hopefully, a cure. Current treatments for long COVID are as varied as its symptoms. This diversity reflects the complex and multifaceted nature of the condition, which necessitates a broad range of therapeutic approaches. Let's start with targeted physical therapy. This is a critical component of treatment for those experiencing debilitating fatigue or muscle weakness. Physical therapists work closely with patients to develop personalized exercise regimes. These regimes are designed to gradually rebuild strength, improve mobility, and enhance overall physical functionality, all while taking care not to exacerbate symptoms. Next, there's a role for medications in managing long COVID. These may include drugs to control the immune response, particularly if it's suspected that the patient's symptoms are due to ongoing immune system activation. In some cases, antivirals or other drugs might be used to target lingering viral particles, if viral persistence is believed to be a contributing factor. It's important to note that medication strategies are tailored to each patient's unique presentation and medical history. Then there are interventions aimed at improving cardiovascular and pulmonary health. These might involve medications to manage blood pressure or heart rate, breathing exercises to enhance lung function, or even interventions like acupuncture or massage to improve circulation. Lastly, but certainly not least, cognitive therapies play a crucial role in managing the mental health challenges often associated with long COVID. Psychotherapists can provide strategies to cope with brain fog, anxiety, depression, and other psychological symptoms. Techniques like mindfulness, cognitive behavioral therapy, and even art or music therapy can be immensely helpful in this regard. In essence, treating long COVID isn't about a one-size-fits-all solution. It's about a comprehensive, patient-centered approach that addresses the wide range of symptoms and their impacts on daily life. It's about finding what works best for each individual and constantly adapting as our understanding of this condition evolves. These treatments aim to manage symptoms and improve quality of life for those living with long COVID. The journey may be long and winding, but with the right support and care, there is hope for a better tomorrow. Incorporating psychotherapy helps patients address the psychological impact of long-term illness, such as anxiety and depression, through techniques like cognitive behavioral therapy. This therapeutic approach encourages patients to challenge distorted cognitions and change destructive patterns of behavior. It's about equipping patients with the tools to manage their mental health, fostering resilience and promoting a more positive outlook. Let's also not forget the role of physical activity. Now, this doesn't mean running a marathon or lifting heavy weights. We're talking about carefully managed, gradual, and consistent physical activity, customized to individual tolerance levels. This could be as simple as a short walk around the block or gentle stretching exercises. The goal here is to gradually rebuild strength, improve functionality, and enhance stamina over time. It's a delicate balance though. Pushed too hard, and one could trigger an episode of post-exertional malaise, setting back recovery. But done right, physical activity can be a crucial component of recovery. Carefully managed physical activity, adapted to individual tolerance levels, can gradually rebuild strength and reduce episodes of post-exertional malaise, enhancing overall recovery. Though long COVID is a challenging and evolving puzzle, combining scientific understanding with comprehensive care strategies offers hope. We've delved into the perplexing nature of this condition, from its broad spectrum of symptoms, such as crippling fatigue and brain fog, to the unpredictable post-exertional malaise. It's clear that long COVID doesn't discriminate, affecting those from all walks of life regardless of their initial infection severity. We've also explored the possible mechanisms behind long COVID, from immune dysregulation and viral persistence to vascular damage and potential autoimmunity. Each of these possibilities sheds a different light on this complex condition, offering unique avenues for research and treatment. Speaking of treatment, we've discussed how a multifaceted approach, including physical therapy, immune-modulating medications, cognitive therapies, and a carefully managed physical activity regimen can help manage symptoms and improve quality of life. This multifaceted approach helps patients manage symptoms more effectively, providing hope for a better future for those living with long COVID. Thanks for watching. If you found merit in this video, please share, like, subscribe, and comment below so we can learn what you would like to see in the next videos.